All right, so I'm going to be doing the mouth care for an unconscious resident. So the first thing I'm going to do is I'm going to do hand sanitizer for my hand hygiene. I'm going to put that on. I'm going to gather my supplies. And then I'm going to knock on the resident's door. And this is an unconscious patient. So CNA may come in. No answer, unconscious. CNA coming in. Hi, Mr. Bear. My name's Bailey. I'm a CNA. I'm going to be helping you with some mouth care today, okay? I'm going to just check your wristband. Make sure it's the resident. All right, I'm going to begin and get started, okay? So first thing I'm going to do is I'm going to put down a barrier and put all my supplies out. I'm going to fill this. I'm going to begin by filling this half with water and half with mouthwash. And then I'm going to begin putting my gloves on. So this shouldn't take long, Mr. Bear. I'm just going to get in and out and help you with your mouth care. I'm going to make sure they're sitting up. I'm going to have them face towards me. I'm going to put this over them so nothing gets on them. All right, we're going to begin the procedure, okay? I'm going to put this under them, and it's going to stay right here. I'm going to get my first swab. I'm going to make sure none of my swabs, the sponge is coming off. For this purpose, it's going to be highlighters. And then this is going to be my stick to hold the person's mouth open. I'm going to hold the person's mouth open. We're going to begin. I'm going to wet it, and then I'm going to wring out the excess. You're going to hold out, open your mouth, okay? I'm going to hold it open. I'm going to do the right side and do the sides of the mouth. Once I'm done with that, I'm going to dispose. I'm going to get this and then wring out the excess. I'm going to move it over here. I'm going to do your other side. I'm going to clean this side. All right, dispose. I'm going to get this wet. All right, I'm going to do the top of your mouth and your tongue. Dispose. And then I'm going to do the front of your teeth and your lips. Dispose. All right, we're all done. I'm going to put some chapstick on you. I'm going to dab them dry. Put some chapstick on. All right, we're all done. I'm going to clean up now, okay? I'm going to leave my glove on. I'm going to take this over. I'm going to keep his mouth care on his desk, the stuff that he's going to keep, and then the used sponge tips I'm going to dispose of. I'm going to take off my gloves, and then I'm going to re-sanitize and make sure everything's cleaned up. All right, Mr. Bear, I'm all done. Before I leave, I'm going to check a few things, okay? I'm just going to make sure you're aligned and that you're comfortable in bed. I'm going to follow the care plan if I'm going to put him back in the laying position or keep him propped up. He's not going to be fully down, though. I'm going to make sure his call light is in his hand and his bedside table is going to be within reach. I'm going to make sure his bed's in the lowest position. It's locked and the side rails are up as needed. I'm going to make sure the privacy curtain is back open, and that's another thing I would make sure it was closed before I first started the procedure. I'm going to open it. All right, Mr. Bear, if that's all, I'm going to let you go, and I'll see you in a bit, okay? I'm going to leave. I'm going to sanitize again. I'm going to take my things that I'm going to take with me out of the room. And then I'm going to document.